thank you all for coming, especially Stella because it's her birthday. Raise the roof, she's 9. So I am Dr. Dixon, or Marjorie Dixon, and I am the CEO and Medical Director of Anova Fertility, which is a fertility center in Toronto, Ontario. And I'm going to tell you a little bit about us and our mission and our vision and how we can help you grow your families. So we actually put the entire mission statement in here, but mainly Anova was built from its inception as a place where everyone could come to grow their family, because when I first trained, the LGBTQ community was somewhat marginalized within fertility care. It was almost like we weren't considered. And it was important when I eventually endeavored to build an IVF center that everybody had access to growing their family. And it was very important to me to not just marry the principles of inclusion and accessibility, but also for it to be gold standard medical care and global standard medical care that would actually improve pregnancy rates per cycle, not just for the fertility population, but also for our LGBTQ community. So this is actually one of our couples, and they ran a story in the news, but these gentlemen just welcomed, not so much just now, I guess now she might be 8 months old, but for them it was very important to be in a place where they felt safe, and they knew that we knew how to take care of their egg donors and gestational surrogates, but we also had the best technology for them to make the time from planning your family to take home baby the shortest and most manageable experience possible. Okay, so our commitment to you is, I know that there are a lot of providers here, which is lovely. It can be overwhelming when you enter this realm, because you're like, okay, I get all this information and I don't know where to start, and I need to know which agency to go with and what gestational surrogate I need to use. I think our goal is to make that whole process from start to finish more manageable. Mara is our team lead, who's here with me today, and the person who's in the administrative unit as well is also upstairs, Tair, and we work together continuously and consistently to move the ball forward as you go along your journey. So we were finding initially when we had started years ago that it kind of got disjointed, because people would show, we'd make the embryos and then they wouldn't come back necessarily in an efficient fashion. And we just want to help you grow your family and be off. So that's our mission, to be dedicated and consistent, and also to be competitive. So what to expect when you arrive at a fertility clinic. You have a consultation. So the physician's job is to talk medicine. Much as I can speak to the program, we have the programmatic people, but the doctor's job is to make sure that the person or the agency or the eggs that you pick are the right eggs to grow your family with, because not every egg donor is going to be created equal. We have parameters, medical parameters, because we understand when we're assessing egg donors. Ovarian reserve parameters vary from person to person, and it is important to pick someone who's young as well, but not every young woman will actually make great eggs. So we want to pick a candidate that's good for you. In as much as the assessment of the egg donor, we also take a health history from both the intended dads, so that we make sure that we've done the appropriate screen, infectious screens, and then also anything medical. So for example, I had an intended dad the other day that I was interviewing that told me that he had had undescended testicles and that he had surgery when he was 8 years of age. So it was important to get that out of the history so that I could use that in as much as when we were talking about, you know, what proportion of which dad's sperm we were going to use. I said, well, it would depend on what we see when we actually get the semen analysis, and we'll make that decision afterwards. So there's that whole medical conversation. If anybody's on any medications, if there are any things that you need to stop so that we can improve the quality of your sperm before we actually test it, all those things come out in that initial interview. We also talk about DNA fragmentation versus semen analyses. The semen analysis is the standard. You look at the sperm, how much is there, with how much purpose is your sperm moving, the morphology, are they shaped nicely, do they have nice round heads, or do they have pinheads, or do they swim backwards, like all those things are important. So that's the standard semen analysis. A DNA fragmentation assay is looking at the genetic quality of the sperm for fertilization. So they're two separate tests, and depending on the packages that you choose, like if you want something that's guaranteed, so that says that your baseline parameters are all perfect, you must do the DNA fragmentation assay as well to see if you qualify, okay? Clinic services. So what we offer, we're a full service IVF clinic, but we're also a women's health center. So we do cycle monitoring. So if the egg donors are coming in for just their assessment, we do that. We actually work with agencies to do some of the baseline assessment of their egg donors. for candidacy as part of their program. We'll do blood tests and ultrasounds. We have a full IVF lab, an embryology lab. And then we also have an andrology department. So there are many departments when the egg donor comes into the clinic. So we have egg donors flying from all over the world. When they come into the clinic, they have the admin department that they meet with. They also see the ultrasound department, the bloodletting department where we run the biochemistry labs on site. And then on the other side of the clinic is where the ORs are, the surgical procedure rooms. Sometimes if we see that the gestational surrogates have polyps, we can actually take them out on site because we also provide women's health. Okay. We also have financing available. That's because of our mission and our commitment to accessibility to all. We were finding that people of different socioeconomic statuses couldn't access the care. So we have programs for payment planning as well, and we have a finance department that will speak with people individually. So as I mentioned, we have an integrative wellness group that is on site. So it's comprised of acupuncturists, naturopaths, the massage therapists, chiropractic for fertility, and they work in concert with us. So for example, if we're seeing our fertility patients, often they'll want to have access to these services to help with the whole treatment of the entire patient. Our couples even sometimes are coming for massage therapy. So it just helps the journey be manageable, but it's important when you're thinking about your gestational surrogate. We have the acupuncturists who will come on site and, well, it's down the elevator really, and do the acupuncture at the day of the retrieval and transfer. So they develop a relationship also with the gestational surrogates and the egg donors. And there have been studies that show that there are improved outcomes with these therapies, okay? So preimplantation genetic testing, if you've heard of PGS in the past, preimplantation genetic screening, this is the PGS 2.0. So it's called preimplantation genetic testing for aneuploidy. So that means that we are testing the embryos after they're created, so eggs and sperm together, we create the embryos with one intended parent sperm, two intended parent sperm. We grow out those embryos to day 5, which they're called blastocysts. Sometimes they turn into blastocysts on day 6. At that point is where we take a biopsy of the trophectoderm cells. Imagine a soccer ball and a portion of the tiles are taken off, somewhere between 4 and 10 cells. The DNA message is amplified from each of those cells of each embryo, and then we get an information about that embryo. So the embryos are identified. You'd have blastocyst 1, 2, 3, 4, 5, 6 for intended parent 1, whatever we have. And then once we find out the genetic information, then we would only plan to transfer back into your gestational surrogates the genetically normal embryos. So they're called euploid. So we're testing for aneuploidy. We identify the abnormal embryos, and then we pick to transfer the good embryos. Why are your lab and embryologists so important? So I speak to this a little bit just because I find that this is a piece that patients don't necessarily understand. They figure you're an IVF lab and you all have the same standards of care. We are held to different standards depending on what your affiliations are. But I can tell you that when we built this lab, we had to prove that we were going to do a better job because we put all the fancy bells and whistles. It's like a spaceship. It's a clean room. Everything was built downstream from the laboratory, and we had international consultants come in to do it. We did that because we wanted to make sure that our pregnancy rates per cycle were superior because we couldn't come in as new players and not do that. And we are finding that our patients are getting pregnant with 1.2 transfers. Those are our infertile patients. So our patients who are not infertile have the highest rates of pregnancy per cycle. So we're really living up to our mission of shortening the time from your assessment to take home baby. And then also the checks and balances that we have in different kinds of labs are just at a different level. So it's important, regardless of whether you come to Anova or not, it's important for you to understand the difference between clinics and to ask those questions of the physicians when you're seeing them for the first time. Surrogacy in Canada, financial savings up to 50%. One, we're always on sale because our dollar sucks. It is what it is. But two, there are some other advantages from a comfort perspective, because in Ontario, where we are located, there's something called Cy and Ruby's Law. So I was involved in lobbying the Minister of Health, actually, to increase accessibility to fertility care for patients. And part of that was the legal group that changed based on a certain case. And so now it means that all of the intended parents at the beginning of the journey are actually included on the birth certificate. So I know when you're using somebody else's gametes, you often will worry that you'll have a crazy stalker gestational surrogate who's going to take off with your baby after you give birth, and her name is on the birth certificate. Like it's in the back of your head, I know, because I have donor-conceived kids, so I actually know that you worry about the stuff that other parents might not understand. So now that we have this law passed in Ontario, from the beginning of your journey, the intended parents are who are considered to be parents legally in Ontario. So that's a big plus for patients. It gives you at least some peace of mind as you are losing a little bit of control as you grow your family. Okay? And Toronto is pretty LGBTQ friendly. It's a fun city, and people can come, and we have a concierge service. So if you come, you can go high or you can go low. So you can go like fancy and stay at the Four Seasons and go to Michelin-rated restaurants and have like a tour of different plays that are going on. We have Broadway plays in Toronto. Or you can just come be utilitarian. There's a hotel that's down the street from the clinic. You can come, deposit your sperm, and then go back to your city. We're 10 minutes from the airport, the international airport, Pearson. And this is our group. We're actually more now. So we have more REIs, but it's important to be in a center where the doctors who are involved in your care believe in you and your family and understand the potential barriers to access and to care that you might have had in the past. And we're mindful of that, and we just are so proud to be able to say that we do this and we do this well, and we intend on continuing to be setting the standards for care provided to our patients, not just from being the best. We always wanted to be the best, and we've grown pretty quickly. We don't intend on being the biggest. So we have subsidiaries, that's nice, but mainly we want to be best, and we're continually and in a never-ending fashion innovating and improving what it is that we offer as services to our patients. We, from the perspective of all of the team leads, are continually doing continuing medical education. So it's important for me as the medical director that all of the departments are best in class, because if you get complacent, things will not keep moving forward. You have to push your ball up the hill. So anyway, we're a great group, and they're pretty good looking. Not me, but the rest of them are pretty good looking people. And we are big supporters of the LGBTQ community in Toronto and worldwide, and we endeavor to go places where particularly people are discriminated against, or gestational surrogacy is illegal. We speak French, so in France we do a lot of that as well. So we do our Skypes in French, which is really nice, puisque je parle en français, c'est la même chose pour moi, anglais, français. I can do a pequeño de español, pero no mucho, let's just say. And just some pictures so you can see the standard, and I'm a little OCD about cleanliness, and so it's important for us to be able to make our patients feel comfortable and then to provide world-class care. So this is in Toronto. That's our waiting room on the IVF side. These are our pre-op and post-op bays. So the patients come into this in the morning, and they sit there before they go into the OR, and they come back to these areas, and they're fully equipped like a hospital. So we have emergency call bells, we have oxygen, we have heart rate monitors, everything in the room, and a nursing staff that attends to those patients. These are our ORs. It doesn't say Anova Fertility on the television, but note the clouds in the sky. And patients actually can come in. Sometimes for the transfers, we have both dads in, the gestational surrogate's husband, the gestational surrogate. It's a party in the room, that's why they're big. And then also you get to see, on one of the monitors, you see under the microscope, so you actually see the microscope, and then you see the transfer, so you can actually watch your embryo going in. Quick, Mara, questions?